Hello everyone, my name is Megan Harris and I chose to do my presentation on cardiomyopathy, the disease and how it affects patients and their families. So first off, what is cardiomyopathy? It is a disease of the heart muscle in general. However, specifically, there are 5 types. These types are hypertrophic, dilated, restrictive, arrhythmogenic right ventricular dysplasia, and finally unclassified. I'm going to talk about the 4 common ones later on in the presentation. However, unclassified cardiomyopathy is that which does not fit into any of the 4 previous categories. Now let's discuss causes and risk factors. Cardiomyopathy can either be acquired from factors later in life or inherited through your genes. Some common risk factors include a family history, which would be the genetics or inherited side, diseases like coronary heart disease or a viral infection that affects the heart tissue itself, diabetes, obesity, alcoholism, and long-term high blood pressure. Now let's discuss common symptoms, diagnosing, and treatment. Common symptoms of all types of cardiomyopathy include shortness of breath, edema, fatigue, chest pain, and chest tightness. Once you have these symptoms, it is a very good idea to go see a doctor, particularly if you have a family history of the disease. To diagnose the disease, first, a physical exam and a family history will be completed. Next, there are several lab tests such as EKGs, echocardiograms, and blood tests, and other procedures that can be completed to track the rhythm of your heart and diagnose you with cardiomyopathy. Treatments include lifestyle changes such as cardiac rehabilitation, exercising, eating healthy, and quitting smoking, medications to balance electrolytes, rid your body of excess sodium, maintain a healthy blood pressure, and decrease the stress placed on your heart. Surgeries can implant pacemakers to maintain a normal heart rhythm, or transplants as a last resort to completely transplant a new healthy heart and take out the diseased heart. All of these treatments have a large effect on the individual. For example, my grandfather had a heart transplant 4 years after he was diagnosed with cardiomyopathy. Because of this, he avoids crowded places because he is on many immunosuppressant drugs. This means he can't go into high school graduations or crowded restaurants where there might be viruses or infections that he could catch. In addition, the medications he is taking have a large effect on his body. For example, a cholesterol medication he was taking caused him to become a diabetic. So now he has to learn how to live with diabetes on top of being a heart transplant patient. Cardiomyopathy has a large effect on the patient's life and can lead them to have to quit working or greatly alter the physical activity or the lifestyle habits they may have led their entire life. Now let's discuss a specific type, hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is the primary disease affecting heart muscle, and it affects about every 1 in 500 Americans. It is characterized by a thickening of the heart wall and is seen primarily in individuals older than the age of 50. You can see in this diseased heart on the right of your screen, the central septum and the wall of the left ventricle are significantly enlarged. This decreases the internal space in the left ventricle, which therefore decreases the amount of blood that is able to be pumped out to the rest of your body. In males, primarily the left ventricle is affected, whereas in females, it is primarily the right ventricle affected. Pulmonary hypertension has been shown to increase the risk of coming down with this disease. However, it is primarily inherited through your genes. Over 27 genes in 1,400 locations have been shown to be linked to hypertrophic cardiomyopathy. The next type is dilated cardiomyopathy. This disease is the 3rd most common cause of heart failure and is characterized by ventricular dilation and impaired systolic function. You can see in the dilated cardiomyopathy heart, the left ventricle is significantly enlarged and weakened, which hinders its ability to pump blood to the rest of the body. The outlook of having dilated cardiomyopathy is not very great. Over half of the patients with this disease die within the first 5 years of being diagnosed. Next is restrictive. This is one of the rarest types of cardiomyopathy, and is characterized by the ventricles becoming stiff and rigid. It can be caused by secondary causes such as irradiation, but the primary cause again is genetics. The only treatment long-term for this disease is transplant. You can see in the diseased heart, this picture is showing the heart wall as being stiff and rigid, which if you think it would be like trying to pump a hard plastic ball versus pumping a squishy balloon. You're just not going to be able to pump as much blood out of the heart because that wall is so stiff and rigid. The last type we are going to discuss is arrhythmogenic right ventricular dysplasia. Now, this disease is characterized by fibrofatty tissue replacing the muscle in the myocardium. It is more common to lead to sudden cardiac death, particularly in young males who are partaking in rigorous exercise. So a lot of this sudden cardiac death you might hear about in the news for professional athletes or high school athletes could be caused by this type of cardiomyopathy. Because this fatty tissue is taking over from the heart muscle, it leads to electrical abnormalities, arrhythmias, and syncope. So far, there have been 13 genes identified leading to this disease, and it is extremely difficult to diagnose because it's hard to tell that this fibrofatty tissue has been affecting the heart wall, which makes it very dangerous in young athletes. One of the hot topics in treating cardiomyopathy currently is the use of genetic testing. I want to touch on this because it has had a large impact on my family in the last few years. The current consensus is that genetic testing should be completed on children to determine the cause of symptoms or to start treatments that could affect a condition to come later in life, such as cardiomyopathy. The decision to test should be made in the best medical interest of the child, but the parent should also take into account the social and psychological implications of being tested. Furthermore, cascade screening is genetic screening for individuals not yet showing symptoms but have a family history of the disease. First, a diagnosed family member is tested to ID the exact gene linked to the disease, and then other family members can be mapped for as low as $200. If they are found to carry the gene as well, they can start screening sooner because they are at a higher risk of heart failure and sudden cardiac death. If wanted or deemed necessary, this may help the patient decide to have a pacemaker implanted as a safety precaution in case they go into sudden cardiac arrest. However, there are downsides to being tested as well. First, there is a chance that an incorrect DNA pathogenicity could be detected, and the patient could live thinking they have the disease when they do not. In addition, if the patient is found to be gene positive for the disease, this could hinder their ability to get health and life insurance because they have a pre-existing condition. Although currently in the U.S., federal legislation forbids genetic discrimination, we do not know if this will change in the coming years. For me, I have made the decision I do not want to be tested. I know I am at risk. I have a significant family history. I choose to continue monitoring myself regardless of gene testing to avoid the possible negative outcomes. However, this is a decision everyone has to make on their own. I hope through this presentation you have learned more about heart health and how it affects America.